Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HSHS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carle, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way.
Hi, I'm Key-Ann Armstrong. I'm your host of Being Well, and today we are going to be talking about when to seek a provider, the right provider, and what to seek them for, and when is the right time. And joining me today is Dr. Asia Lystila, and you're with Carle Family Medicine on Hurst and Mattoon. So thanks so much for joining us today.
Thanks for having me. I appreciate it.
Yeah, we've got a lot to talk about, I think. So we're going to be talking about when to seek the right care and who to seek it from, right?
Yes, ma'am.
All right, so where do you want to start with this?
Well, let me start with why it's important to have what we call a primary care provider.
All right.
So primary care providers are those people that have their arms wrapped around your care as a whole person. And so primarily these are family physicians or internal medicine, also known as adult medicine doctors now. And for kids, pediatricians count as well.
Okay.
And so it's important to have somebody who knows you as a whole in order to get good care, to get affordable care at the right time in the right places. In our region, access to primary care doctors can be a little bit difficult, and so we function actually as teams to provide that care. So we have advanced practice providers, is what they're called, nurse practitioners and physician assistants that work with us and help us provide that care to our patients as a whole.
Okay, so you have a team of people that work as primary care providers, not just one physician.
Yes, ma'am.
All right, so what can you expect from a primary care provider? What's a patient going to see a primary care provider for?
Sure. Almost anything. They're the right place for a first look at things. So is this something that needs a specialist opinion? Is it something that can be taken care of? What things do I need to do to be healthy and to stay healthy? And so a lot of what we do in primary care is we call it preventive medicine. It's trying to identify the track to a problem before it's a problem and make an intervention and change there.
Okay, so would you see a primary care physician or provider on a yearly basis? Like how many times?
Yeah, if you're healthy and not taking any medicines for anything, once a year is usually what we recommend to kind of check in, make sure we're identifying any vaccines or health screenings that should be done to keep you healthy and see you before there is a problem. If you have medical problems, then often that pattern may be different based on those problems. There's a pretty standard, maybe 3 month, 6 month check-ins, depending on what sorts of things you've got going on.
Okay, so how do you go about finding a primary?
So in our region, all of the Sarah Bush and Carle both have primary care doctors that have what we call open panels that are available to take in new patients. You can call our call center, Sarah Bush's call center. You can go on our website as well to identify who has an open panel, who can I sign up to be with.
Okay, can we talk a little bit about the differences with, say, family medicine versus adult medicine and pediatrics? I mean,
sure.
Doesn't family medicine cover it all?
Yes, family medicine, we consider ourselves birth to death. We have at Carle a couple of family physicians who also do OB, so they also deliver babies. And then we have adult medicine see 18 and older, and then pediatrics see children up to 18, sometimes they'll hold on to you till you're 21. In that range when you're becoming an adult.
Yeah, well, that's okay. And if you work as a team, then you probably become pretty familiar with your patients.
Yes, exactly. And we try to transition care when needed. So if somebody has a pediatrician and we call it aging out, graduating from the pediatrician, it can be a smooth handoff to someone who takes care of adult patients.
All right. So we all hear that doctors' offices are busy places, and you work at Carle out here at Mattoon on Hearst, and lots of doctors' offices are busy. You see patients in there all the time. So how does Carle address the challenge of serving so many people?
Right. We address it in a couple different ways. So all of our providers have, we call them same-day ad appointments. So I'm sick, I don't feel good, I need to be seen. We have slots available in the mix of maybe your pre-ops and your hospital follow-ups and those sorts of things that are happening. So we have slots set aside for that. We do, at Carle, we are a patient-centered medical home, which kind of allows us to take a look at our patients, not just the ones that are in the office, but our whole patient panel, and reach out to them in different ways to make sure they're getting the care that they need for preventive things. We have a walk-in clinic, we call ours Convenient Care, that's available after hours and during the day, no appointment needed. You can just come in. You can actually do online scheduling for that if you don't want to wait as well.
Oh, okay.
And then we also try to do some care out of that face-to-face doctor's office time with, we call them e-visits. And so patients established at Carle can sign up and send a message for conditions that often you could manage just by the symptoms that are going on, and get a treatment. So you log in, you answer your questions, it gets sent to the doctor, and you get an answer.
Okay.
And then we have My Carle, which allows sort of more of a discussion back and forth, less definite questions where you can manage patients. So we're really trying to look at how do we take care of the whole population and not just those patients that are physically here in any moment. The last thing that we have that a lot of people don't know about is Carle Insta, which is it's like a virtual doctor. So you can get an app on your phone. You should have it before you need it. Nothing like trying to download an app when you're like, I need this today.
I'm sick, I don't feel good.
Right,
exactly.
exactly. And so having it downloaded on your phone so that you can reach out. They have access to your Carle chart, everything that's been going on, your visit with them. It's like a FaceTime thing. Gets downloaded into your chart at the office, and so it just kind of expands that team that's helping take care of people.
So with that app, do you talk to somebody face to face on the app, like with a physician? Or?
Yes, it's a physician. Yep,
okay.
On there, and it's like FaceTime, but on a secured platform.
Like Skype or something.
Yes,
like that.
exactly. Yep.
Well, that's interesting. So do you see that maybe the younger generation is using that, or is the older population using that? Are they becoming adapted to the digital technology?
I think both are, actually. Yeah, when we first started doing the My Carle and the e-visit stuff, we thought it would be all younger people, but you know what? It's not all younger people who can figure out technology and use it to their advantage. And so, it's becoming more and more popular, sort of getting the care you need when you want it. There are times that the things that come across there, you need to be physically seen so somebody can hear your lungs or look in your ear or those sorts of things, but a lot of things you can figure out what's going on just by talking with people, and so it allows that care to be delivered there.
Okay, so this is probably something that if I was watching right now, I would want to ask, is something like that covered by insurance? Is it the same thing as a typical visit?
It's usually not covered by insurance. There's a set fee. I don't want to make up the number. I'm not sure what
fine.
it is. It's probably pretty comparable to what a copay is, for an office visit for people. Where insurance companies are moving there, but most don't cover the Instacare, what we call the telemedicine stuff yet.
Yeah, I think it's interesting all the different techniques that a person can stay on top of their health these days, such as My Carle and other providers have different things that are available out there, via the web or apps or things like that. So, I mean, when you're talking about preventative medicine, that's a way to stay on top of your health, is to, go into your own medical history, right?
Exactly, and so we really encourage people to sign up on My Carle. The nice thing is when your tetanus vaccine is due, it'll alert you that, hey, your tetanus vaccine is due, or your next women's health exam or your mammogram or your colonoscopy. And so it alerts you to those things that can sometimes fall through the cracks as we get busy in life.
Yeah. So preventative medicine, let's talk about, is it just, okay, it's not just the yearly checkup, it's just not the yearly screening. Talk about what is really involved in preventative medicine, just to give our viewers a clue.
Sure. When I think about preventative medicine, it is, the lab work to look at your cholesterol, or have we checked your thyroid, or, those sorts of things that need to be done. But it's, breast cancer screening, colon cancer screening, cervical cancer screening, prostate cancer stuff. But it's also, what are your habits? What are your lifestyle things? What trajectory are you on with your health? What risks do you have based on your family history for your health? And what can you be doing now to prevent ending up there?
Okay. So what if someone is not comfortable doing, like the virtual visit, and maybe it's someone's like, all right, you really need to get in to see somebody. I mean, what do you suggest at that point? Do they go to convenient care first, or?
Yeah, I always say it's generally best if it's during regular working hours. Your primary care team is probably the best care you're going to get. They're going to know you the best. They'll know your risks and those sorts of things pretty easily. And so if they have an appointment, great. If they don't, convenient care generally is the place you want to go. The emergency room should be saved for those things that are true emergencies. And so the things I think of are, I'm having chest pain, I can't breathe, I hit my head, we're worried about a spinal cord injury. Those sorts of things are emergencies. So I always tell people, if it crosses your mind, should I go to the ER for that? The answer is probably yes.
Yeah, if you have to ask.
Right. Generally yes.
Yeah.
But all those other things, I have a cold, I hurt my ankle, my shoulder hurts, I generally don't feel good, I think I have a bladder infection. All of those things,
yes,
you don't need to go to the ER. You can come to a convenient care, a walk-in clinic, and get that care that you need, and quickly, usually at less cost, less wait. ER waits can easily be 6-7 hours, depending on what emergencies they have that come in.
Right, it's a lengthy process sometimes. So convenient care is named that because it's convenient.
Yes.
So you can walk in. It's like a walk-in clinic.
You just walk in.
Okay.
You can also, at Carle, you can go online and schedule a time, so that kind of moves you up in the wait. And so as long as you arrive by your time, you don't have to sit in that pool of people waiting.
Right, with everybody that's sick out there, and you have to wear the mask and think, what else am I going to walk out of here with?
Exactly.
Right, okay. So what's the difference between convenient care and urgent care? Because when you say urgent, that seems to me like it could almost be emergency. How do you define the difference with urgent care?
Sure. What we think of as urgent care, we are going to call convenient care plus in the Carle system. It allows for more diagnostic testing. So a walk-in clinic or just convenient care may only be able to check for flu or strep and bladder infection, but no other lab evaluation and maybe no x-ray evaluation of things. Urgent care is going to be able to do those other testings. And so when I think of, well, then what's the difference between urgent and emergency?
Yes.
Emergency things that aren't appropriate for urgent care. So I can't breathe, I'm having chest pain, those sorts of things. But also, like, I'm in so much pain, my expectation is they're going to give me something in an IV for pain control.
Yes.
Those are things that urgent care or convenient care pluses aren't equipped for. Okay, those are emergency room level things.
So I guess the question, if I would be watching this program right now, is convenient care and urgent care, are they located in the same facilities? Do you go somewhere different?
Sure. Our facility, we're currently a convenient care who does some urgent care, convenient care plus services during different hours. We are going to be expanding to a convenient care plus or more of an urgent care situation. So it'll be one building and you go for all of those things. There are some other places that are just a convenient care or walk-in type situation that may not have that extra diagnostics lab and imaging things. And so being clear about which one's what, I think is important when you think about where am I going for this. And so knowing your local resources of who has what, are the different places going to be able to do an x-ray if I need it, or lab work if I need it, I think is an important thing
so
to
just
know.
get familiar with the facilities in your area
Yes.
and what's provided. And so with urgent care, is an appointment needed? Or
No,
is it more like
it's more
convenient
like
care?
convenient care.
Okay.
Yep, just come in and you need to be seen and they'll get you taken care of.
All right. So do you see people a lot in the emergency room that maybe don't need to be at that level and they should have maybe backtracked a little bit and gone to one of these other facilities?
We do. I mean, it's a nationwide thing. It's not just here, but there is a lot of, our fancy term is overutilization, too much reliance on the emergency room. And sometimes it's because they know they're going to get taken care of. There may be a wait, but they know that somebody's going to see them for that problem. And so knowing that, hey, there's these other resources in our community that you can go and get that care is important.
Okay. Now, is there a difference in the health insurance coverage depending on which one you go to?
So usually your copays are going to be much less at a convenient care and outpatient situation than an emergency room.
Okay. So I have a note here that says you're seeing a rise in urgent care centers in the region. Why do you think that is?
I think it's trying to address the cost of health care and trying to put patients, we always say, the right level at the right time. You know, how do we have services available outside of work hours? You have a job from 8 to 5, but I don't feel good. Do I have to go to the ER or do I have to miss work?
Right.
And so it addresses that. And so it's more cost efficient. It's better for health insurance companies. It's better for the state. It's better, it's better for patients, frankly, than having to be in the mix of the ER situation where there's lots of other things going on.
Okay. Now, do you see a difference maybe with age or like if it's children thinking, well, I'm scared that my kid's never been sick. I need to take them straight to the ER, and maybe helping parents work through some of those things. Like what's some signs when they need to know whether to take them to convenient, urgent, or emergency? Because for first-time parents, that can be a scary thing.
Yeah. I would say that probably the most common thing that should go to the ER for kids is difficulty breathing. So we always say their nose are kind of flaring. If you can see between the ribs because they're working hard to breathe.
Okay.
That's an emergency situation.
Okay.
If they have a fever, if they're fussy, if they're not acting right, that's probably go to see their primary or go to the convenient care to get seen first is probably the better place. Injuries, they cut themselves, they're, seem to have hurt their leg, those sorts of things. That can go to a convenient or urgent care situation and not the emergency room.
Right. But what if convenient care or urgent care hours are not open and you're thinking, well, my child has a really high fever. Go ahead and go to the ER, or what do you recommend?
Or use the Insta care is a great resource in that situation because they'll help guide you. They'll, give them some, Motrin and Tylenol. They're otherwise acting okay. Watch for these things and be seen in the morning, because often things can probably wait till morning and you just want that reassurance as a first-time parent that they're going to be okay. Yes, it's a fever, but fevers are okay. They're there they're there for a reason, I always say.
They're there for a reason to fight off whatever there is.
Exactly.
All right. So let's change the gamut here and let's go over to the older population and some folks who may be taking care of their parents or something in that realm of reality these days. So will people be able to go to the primary care providers with their parents or grandparents, and how does that play into knowing and being a part of that preventative medicine?
Sure. Very common. I primarily take care of older people, and so most of my patients are over 65, and so very common that at some point they'll engage their kids to be part of their care. And I think it's important and wonderful to be able to use that. Again, I think about healthcare as sort of a team sport, and so if your kids are part of your team, great. If it's a friend, great. Whatever you need to get good care, and so making sure that if you want your kids to be able to ask questions on your behalf and those sorts of things, that you sign releases at the doctor's office is probably the biggest thing that I remind people, because we protect your health information. We're not, even if it's your daughter, if you haven't said it's okay to tell her, we're not going to tell her.
Okay, so there's release forms at the provider's
offices. Yep.
Okay.
Yep. In order to tell us who we can give that information and share that information with.
All right. Well, that's good to know, because a lot of people are in that situation, or if there's something that they need to be a part of, and they're trying to help, maybe get their parents to the doctor, and they're seeing something, they need to be a part of that. So then they reach out to the primary care providers to, seek out that health care, right?
Yes, ma'am.
Okay. All right. Well, good to know on that. So let's go back to the emergency room situation. If you're concerned, should I call 911? Should I not? Is it another thing, like if you got to ask, you should probably do it?
Yes, that's sort of my motto. If you're thinking, should I call 911? Should I go to the ER? Probably the answer is yes, because that thought typically doesn't cross our mind unless something major is going on.
Yeah, and at that point, maybe don't be so reliant on, is this covered by insurance?
Right,
know ahead of time.
Yes, exactly. And generally, emergency room is going to take care of you. Insurances cover the closest ER is where you're supposed to go. If you then need to stay in the hospital, knowing your insurance as far as which hospital is within your plan is important.
Okay. Well, we've covered a lot of different things here. We've got about 5 minutes left in the show. Is there anything that maybe you get asked as a primary care physician that we haven't covered at this point?
Sure. I think a couple of things. One is patients often ask about advanced practice providers, so nurse practitioners and physician assistants. And so I always say, we work closely as a team. All of our advanced practice providers have we call it collaborating physician that they work most closely with, but they work across the whole team, and they are our left hand. I always tell patients, you can't hide from me. If you see my nurse practitioner, she's going to tell me what's going on.
Right.
If it's something that she's better at taking care of than I am, she's going to do it. If there's something that she's unsure of, she's going to talk to me, and we're going to make a plan together for what makes sense for you. And so I think sometimes people are hesitant because they're not doctor, that maybe they're not getting as good a care. But the evidence will tell us that advanced practice providers are probably better at preventative medicine than doctors are. And so utilize them, use them for your routine physical, have them be part of that team that knows you well. And that frees up the doctors to then see if you're sick and those more complicated things. That's sort of the difference in our trainings, is that, doctors are trained very well to fix problems that are there. Nurse practitioners are very good at helping prevent them. And so utilize that care team as a whole to get better care for yourself, I think is
which
important.
plays all into the same topic that we're talking about today, who to see at the right time and for what.
Exactly.
All right, well, that's interesting. Now, is there a difference in maybe whether a nurse practitioner and a doctor can write prescriptions, different things? What's the difference right there?
So there are some rules about controlled substances, which is actually changing in Illinois, coming up, but about controlled substances for nurse practitioners. They have to have an agreement with a physician about what they can prescribe, and may require a co-signature, but that's it. I mean, your usual medicines for all of your aches and problems and medical conditions, they can prescribe just the same as the physicians.
All right. Well, if someone needed to get more information, where do you tell them to turn to for more information?
Sure. I think Carle's website has lots of information about our local resources, but also Carle as a whole for information, I think is probably a great place to start for that information. So
okay, do they need to turn to their health providers to find out maybe what primary care physicians are in their area and who to reach out to? Is
right,
that
who's covered on their insurance plan is probably an important thing. You want to make sure that you're establishing care with someone that you can afford to see because they're covered on your plan.
Yeah, that plays big into preventative medicine and going to the doctor, and whether it fits in a budget.
Exactly. Yep. And so making sure that you know who are your covered care teams, which places can you go to.
Okay. So do you think it's best if you're a family to find a family medicine doctor, or should you really start with a pediatrician and adult medicine? I mean, what's like the very first step for people?
So it's really personal preference.
Okay.
I'm a family physician, so obviously I think we're wonderful.
Well, yeah, of course.
But our pediatricians are awesome, and this is what they do. They do that small bucket of kids, if you are an adult medicine physician is going to do for you what a family physician can do too, So I think it's more about finding the provider that you feel that you can talk to openly about things that are going on with you so that you can get good care. I always say it's like marriage, you shouldn't
Yeah.
marry everyone you ever dated.
Right.
You probably should check out a few physicians before you pick, this is my doctor, this is my team.
Who you feel most comfortable with and who you can share, your health history with and
Exactly.
feel
All
like
your
you're going to
concerns.
get the care
Yes,
that you want.
Exactly.
All right. Well, that's been really interesting to find out all the different aspects of preventative medicine and where to go and who to seek at the right time. So thank you so much for joining us
No
today.
problem.
It's been a
It's
pleasure talking
my
to
pleasure.
you.
Thanks.
And thank you for watching this episode of Being Well, talking about preventative medicine, who to see, and where to go at the right time. If you need to see more information about this episode or more about Being Well, check on our website and click on Being Well. Thanks for watching.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carle, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way. Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.